Today and tomorrow we work for 2 days for Aqualift thread for non-surgical face and neck lifting. Also, I will show you nose for nose lifting. New generation Aqualift PLCL and PDO. This is barb and products and patented barbing technology. And I want to ask you is how many years you are using the thread for you?
3 years.
Yeah, 3 years. You?
1 year.
One.
1 year and a half.
Okay.
4 years.
Four. Good. One. Doctor?
From
2008.
Oh, good.
4 years.
4 years.
I worked before and now I come again.
Okay. Okay, it's good. It's easy. It's easy because
Maybe it's a specification, special.
yeah, yes. Today and tomorrow is a special technique because everybody knows this thread. And this method, moving and fixing the tissue in an aesthetical favorable position. Everybody know this method is introduction, and aging occur. Everybody know the so. I will skip this slide for volume loss and melting the fat pad is normally, and there is important is ligaments. So where make the thread is right plane should be catching the ligaments, and deep fascia smash is good choice and strong lifting and more long lasting result for collagen stimulation is normally, and polylactic acid caprolactone. This suture we are many years using the for stitch and suture, so this material is safer, and 75% is polylactic acid, 25% is polycaprolactone. Together is polylactic and polycaprolactone PLCL, and absorption time is 1/2 and 2 years. So this is strong to taping the tissue. You know, in the market have 3 type material. Now every word 3 type material. One is PDO, polydioxanone. You know, polydioxanone melting and absorption time is 8 months and maximum 10 months. 8 months is finished. Silicone is permanent. Silicone is permanent, but you use polydioxanone or PLCL or silicone thread, no any problem. Every thread type, Aptos, Test Lift, for example, and Mint, and Minerva, different brand, you know. Maximum effect is 2 years, not more.
Silicone
No, permanent.
and permanent.
Permanent, included the permanent, maximum effect is 2 years, not more. Because a different example, we make the facelift, surgery facelift, and remove the skin, remove the fascia, and lifting the smash, 5 years. After 5 years is done. Understand me? So you use thread, not incision any skin. Only 1, 2, 3, 4, maximum 5 or 6 point you are lifting the thread. No any incision, no any remote tissues. So maximum effect is 2 years. In this case, we like is absorbable thread because for non-surgical application, botulinum toxin, mesotherapy, filler, and others, we like is again procedure. We like is again procedure because we want to spend money. We want to spend money. So, so this thread, PDO and PLCL, is safer and safer. Permanent thread is problem. No, in the world, permanent thread is historical. Maximum 7 years ago, we may start using permanent thread, not 10 years. After 5 years or after 10 years, how about the patient face? We don't know this. We don't know this. Okay, so in Turkey, we use polydioxanone, PLCL. Also, same different doctors can use the spring or infinity thread for silicone. I don't use silicone. Okay, I don't use silicone. PLCL is 4th generation, 4th thread PDO, polylactic acid, polycaprolactone, and polylactic acid. Safe, soft and easy touch, long duration, tightening, brightening, and safer. This is 4th generation. It's good choice. Good choice. There is important thing is patented molding press production. What is this? Look, before 2 years or 3 years ago, all the thread using is cutting method. This method, cutting. This is raw suture material. You are cutting, make the barb like as this. Very, very weak and very, very problem. In the market, still some company sell these products. Most of the complication is this thread is rupture and migration. Most of the problem is migration. Aqualift make the molding method, not cut any raw suture material, extra taping the thread, and now is this molding coke suture. This is press production. Also, most of the strong production. In this case, you cannot see any rupture, breakage, or complication. And immediately, dramatic effect is you are seeing. And the K factor is right plane of the face. Now is new technique for a special new technique, not intradermal, not subdermal, not subcutaneous, under the subcutaneous, above the fascia, on the SMAS, superficial aponeurotic system, on the SMAS. SMAS is this. This area is SMAS, skin and subcutaneous. Under the subcutaneous, above the fascia, in the together is retinal ligaments. This is SMAS fascia, and this is picture is you can see this is most explained for your right plane. Look, this is skin. This is subcutaneous fat tissue. This is fascia, and this is SMAS. Fascia. Your thread under the skin, under the subcutaneous, above the fascia, on the SMAS. If your implantation thread is this layer, is most of the strong lifting and long time duration. See in this video, this is a real patient for facelift operation, normal facelift operation. For you, during the operation, we make the thread for your right seeing the right layer. Look, patient is 56 years old, not more fat, slim face. This is during the facelift operation. Look, This is skin, not more subcutaneous, not more subcutaneous. You implantation the thread, and you pull the thread, check the thread's barb, look, no any skin deepening, rupture, no anything. This is very, very deep plane, very, very deep plane. For neck, different, another thread for neck. This is second thread. First is for face, second is for neck. Look, this is right plane, this is right plane, this is right plane. Insert the thread and pull thread, check for barbs. Look, look, only lifting the smooth fascia, only lifting the smooth fascia. This is your right plane for thread lifting, okay? And normally eyebrow, mid face and neck is main target area, main target area. Also, you can treat nasolabial folds, marionette lines, double chin, neck, peroral lines. This area is enough, but there is your vector or design. Your design is for your choice and for your patient request and your dream, your dream. And everybody to know, normally we use is bidirectional. All the world, all the thread is bidirectional. What is this? This is, okay. For example, this is two type. One is cannular cox. For example, Aqualift, Cockmaster Gear 1 or Cockmaster Gear 3 or Cockmaster Gear 4. This is cannular thread. Your thread inside cannula, this barb inside cannula. Normally, for my face, I lifting, the mechanical lifting is good, is good. Okay, now it's down. This is normally. Use this thread, your implantation this line. Lower barbs, catching the tissue, you check the lifting, pull, lifting, okay? Normal. Upper barb is fixation. You're lifting and cannot down again, okay? In this case, in the thread lifting, most important thing is lower barb is traction, upper barb is fixation. So, traction is nothing, fixation is everything. Fixation is everything. You should be strong fixation this area. I see in some video, doctor use the thread lifting for social media. Entry point is here. Okay, normal. Okay, maybe. Entry point is here. Pull, 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 and cutting the thread. This area is your traction, for example, traction. You're cutting this. This is fixation. After 2 months, maximum 2 months, this face is down. You understand me?
Do we need all region?
Yes. All the thread you should be inside. Yeah, yeah, yeah. This 10 centimeter, for example, this is cock thread, for example. All the 10 centimeter must be inside the tissue. Must be inside tissue. Understand this? Okay. So normally, this is our target area. your entry point should be upper, 10 centimeter minimum, 10 centimeter minimum, not 5 or 6 centimeter, 10 centimeter minimum. And Cockmaster Gear 1, dual lifting, 43 centimeter. This is dual double needle. You know, this is cock is blunt cannula, and this is your barb bidirectional. This is your patented molding barb suture, and you can use different vector as different lifting point, different lifting line. Green line you can treat is marionette line jowl sagging. Blue line you can treat is nasolabial fold. Red line marionette fold, marionette line and is submental area, and yellow you can treat is neck lifting. Result is good. No any deepening. Entry point is upper, your target point is here, and your entry point is upper. This is your target area. This is fork size together. This is for face, this is for fork size. Together combination. And also this is good result. Fork size, cat eyes. This is most popular of the application in the world. This application in the world, first time introduction from me. This cat eyes, fork size is 2019 years in the Korea. We make the big export meeting for thread lifting, and my name is periorbital rejuvenation and minimal eyebrow lifting. This name is changed, fox eyes, cat eyes, bella eyes, different eyes. And in the word woman, beautiful periorbital integrity is most important. In shape of the eyes, eyebrow position, warmth, and feminine looks. And normally in the surgery, we have the surgery. Name is ponytail lift. For have you any surgeon in here? Plastic surgeon? Good. Normally, we make this thread is copy of the surgery. Okay, copy of the surgery. Normally, we have the surgery is ponytail lift. Most of the lady use ponytail hairstyle because this area is tight. Some ladies have hair loss this area, most of the stitch, most of the tight. So this area is periorbital rejuvenation. I use Aqualift thread lift for non-surgical ponytail lift. Non-surgical ponytail lift. Two entry point, two thread, maybe 4, maybe 6. This is your choice. Two entry point is principal. These 2 point on the orbicularis oculi muscle. These 2 point, everybody simple apply in the botulinum toxin point. One is eyebrow corner, second is lateral canthus, and 2 centimeter away from orbital rim. And your direction for knot is vertical is 45 degree, because I say you is most of the things is fixation. So you're leading this thread, you're on the way is temporal fascia. So this thread you must be inserted to the temporal fascia and your fixation point on the temporal fascia. In this case, you make this application is long-lasting result.
How much time?
If you use two thread, 6 months. 6 months, no more. Okay, 6 months. Maybe every entry point, two thread, for example. 4 thread is here, 4 thread is here. 10, maximum 12 months. Okay, not more, not more. And this is temporal fascia, superficial. Temporal fascia, you know, is 2 layers. One is superficial, second is deep. Yours should be superficial layer. Catch these thread barbs. And short video for this application. Entry point in the eyebrow corner. 45-degree leading the thread. This area is a temporal fascia area. This area is deep, and deep. 10 centimeter thread. All the thread insert the tissues. All the insert tissues. This is first. Second is lateral canthus, 2 centimeters away from the bone orbital rim, and first and second thread is parallel leading, parallel. There is, look, you can see, there is you feeling the thread, there is you cannot feeling the thread, because this is most of the deep in the temporal fascia. Very simple application, very easy. Young patient is most of the popular in the world. Tight is enough. Tight is enough. Yeah. And this is result. This is the result. Also this. Also this. In this case, please attention. This patient, all the patient is young patient, okay? If your patient need is blepharoplasty surgery, you cannot make this. You first make the blepharoplasty. Okay? This is not is eyebrow lifting. This only is the eyebrow and lateral canthus lifting laterally. This is not eyebrow lifting. Look, patient, all the patient is young. Sometimes have the complication. I use this method maybe 2,000 patients, for the 3-4 years, but only one complication is this nerve injury. Only one. Don't worry. This is nerve injury. After 1 week, check the patient. After 1 week, check the patient. This is deep link, no problem. After 15 days, can disappear without any medication. But lifting the eyebrow. Look. No any attractive discharge, no moment. This is nerve injury. This facial nerve frontal branch. This is phalangoid line. For thread lifting, you can see 2 danger zone. One is this area. Marginal mandibular branch is here. Facial nerve marginal mandibular branch is here. This is for phalangoid linus, temporal branch. If this temporal branch have the injury like this, same as the patient, same as the patient. Normally, this patient eye treatment, this area is no any movement. This area is movement. This moment, I apply the botulinum toxin. All the frontalis is stop the attraction. Patient look to mirror is no anything. After steroid and vitamin B, after 6 months, it disappear. Okay, 6 months it disappear. No, don't worry. After 6 months, should be disappear. No any problem.
But you gave her steroid, yeah?
Hmm?
In this case.
Yeah, yeah. And neck and face for dual. System is same. System is same. But this thread is most of the longer, 42 centimeter, and 2 needle is double needle thread. Use this double needle, you can hang in the tissue. Hang in the tissue. Normally we use this technique, is most of use this technique. This is temporal fascial line. This temporal fascia, you insert the temporal fascia and the fixing point is here. This is your target point. This is your lifting line. Your lifting line. Today and tomorrow. Today is 4 doctors. Tomorrow is 4 doctors make this application for double needle. There is your 2 entry point and 2 exit point, and use double needle. This technique you can use for jawline correction. Jawline filler is most popular also in young lady, because jawline filler sometimes you use most of the filler for jawline. 5 cc, 6 cc, 10 cc. Some patient is this area is have the fat, you cannot make any filler jawline. In this case, you can use this thread. This is seen in this short video for this jawline correction. This is one entry point, and same entry point. One needle is down, one needle is upper. Lifting, traction, and fixation is enough. After you make the filler is best choice.
After filler?
After you can make filler. For example, patient is have the fat, bulldog and fat, okay? Fat. Normally, you inject filler maybe 10 or 12 cc. 10 or 12 cc. But you first make the this thread after 2 cc filler for chin, for example. Perfect. Must make this combination. For thread and filler combination, for a thread combination, first thread after filler, okay? Thread and filler combination, first thread after filler. And for neck, one entry point to right side and left side, you can see in the video.
How much time then the filler and the thread? The same time or after 1 week, 2 weeks?
If you make the thread not more any hematome and trauma, same section you can.
Yeah,
Have some edema, hematome,
it's okay.
or trauma, wait in 15 days.
But usually when you use the threads, you inject it with the, like lidocaine or something. It's swollen.
Yeah.
Yeah,
Yeah.
so
But that
maybe
keeps going.
maybe is yeah. So in this case, you waiting this 15 days is better.
15.
After 15 days is better.
Weeks.
Yeah. Sometimes I may use this technique. One entry point, 2 exit point is here. this second thread, exit point, this lower side and upper, same entry point, front ear, lifting and tightening, and good choice. And for neck, for double needle, today I show you new technique. This is classic double needle technique. Two entry point, one or two exit point. See in the video, look. This is patient for eyebrow lifting. This is your fixation line, fixation area. This is your exit point. This two line is lifting line. Start. Start. Two needle, two needle. This is guide needle, 18 gauge guide needle. This needle insertion, insert and entry and exit for deep plane. Touch the bone on the periosteum, okay? Touch the bone, look, touch the bone, deep insertion and exit, and you pull the thread, look, moment is here. Most of the strong fixation area. Touch the bone. Now is thread insertion. Thread. And lifting point is this. Or Aqualift thread, bidirectional, and on the middle have not barbed area. This is it 3 centimeter, 3.5 or 3 centimeter. So this not barbed area, your use is this area is fixation bar. And this is exit point. Exit point. Safer. This area is safer. This area is safer. Look, you moment this moment, look, you can moment this needle is right plane. You can inside it, you can moment this needle is right plane. Should be above the frontalis muscle, not inserted the frontalis or not below the frontalis. Yes. Look, most of the strong. Other side, start for anesthesia, local anesthesia. We use lidocaine with epinephrine for anesthesia and for vasoconstriction. not more bleeding. This is lidocaine with epinephrine. Okay, lidocaine with epinephrine. This area is deep anesthesia because your leading threat is on the periosteum, touch the bone. So deep anesthesia. This is your exit point. This is your exit point. This area normally you can make anything is very easy for hematome, for bleeding and swelling. So this line for anesthesia I use cannula, not needle, not needle. This cannula is 23 gauge, 50 millimeter. 50 millimeter. Normally, everybody is using for filler injection. This cannula. This line, you can use cannula for anesthesia, and not any hematome, not any bleeding, not any swelling, not any bruising. Small quantity is enough.
The line of threads after near.
Yeah. This needle is 18 gauge, 18 gauge. Is guide needle. You make the curve 90 or 80 degree, look, and insert, deep insert, and exit.
Exit 3 centimeter between point
3
1
centimeter, minimum 3 centimeter, minimum 3, okay, minimum 3 centimeter, because minimum 3 centimeter, because if most of the shot you have deep link.
So how you know this is point if you can't enter in here?
This distance is for your patient request. Some patient need only eyebrow corners lifting. Some some patient lift is the middle mid papilla. Some patient needs this area. So lifting point, target point, your patient request, and your choice, your dream. Okay. And cemetery point also. Look, you can make this movement is right plane, and X point together. Yeah. Now remove the all the bandage and for lifting. Now is only leading the thread, not any lifting. Okay. Now is lifting. For lifting, you pull the thread. One hand, pull the thread. Other hand, lifting the tissue. Lifting the tissue is enough. Yes. Make some overcorrection. Because after 1 week and 15 days is can down 10 or 50%. And down. Maybe more. So should be make the overcorrection.
With the same technique? With the same technique? The
Yeah.
correction?
Yeah. Overcorrection. Look. Lifting, and lifting.
Lifting skin and top fissure, not lifting.
No. Check the symmetry. Yes.
PLACL.
PLCL, yeah.
The potential PLACL.
White color, PLCL.
شوف محزيك شنو أنا خيط. بريك آخر سنة וחצי.
מתפרק.
כן.
אבל החומר נفسه 10
אבל
שנים.
יש שם את הפריפריה, נכון? יש שם את הסטרומה כבר, כאילו, מסביב החוט, יש סטרומה,
נכון.
נכון? יש כאילו רקמה פיברוזית,
כן, בטח.
זה תופר, כאילו, זה מחזיק.
Yes. You can disappear this deep link. It's very, very easy. Look, let's finish.
לדחוף את החוט שייכנס לתוך האור, מלמעלה. אחרי שחותכים.
And before and after. Before and after. Yeah, yeah. And ladies like this. Lady like this. And for nose.
Doctor, I have a question. It's better to do Botox before this procedure to relax.
Before Botox, yeah, before Botox is better.
Before Botox.
Before Botox is better. Before Botox is better. And for thread lifting method, for nose, you know, nose filler is most of the problem. Nose filler is most of the problem. In the world, make the analysis for vascular complication. Vascular complication. 48% first vascular complication is glabella for filler. Okay, please, please, please don't touch glabella filler. Don't touch glabella filler. 45% second vascular complication is nose. Nose. So make thread is very, very safer, very safer. Safer than filler, safer than filler, and easy, easy. You can only one entry point. You can only one entry point. Also can lifting the tip. Also thread in the dorsum. First, there is we use two type thread, Aqualift Viso 2 and Viso 1. Viso 2 is 19 gauge, 38 millimeter short thread. Also have the barb is cock. Also have the barb. Viso 1 is 21 gauge, 60 millimeter long, and also have the barb cock thread. First, same entry point. Use Viso 2, enlarging the columellar angle or nasolabial angle. You make the tip lifting. I informed you. We make is surgery copy. In the surgery, we make columellar stud graft for rhinoplasty. This is our columellar stud graft for rhinoplasty. This is drawn, but real patient is this. This is all rhinoplasty. This is all rhinoplasty. This area, this is septum. This is patient septum, patient own septum. This area we make this and stitch for nose lifting. In this case, normally you also can this area inject the filler, but columellar artery is most of the problem. But use thread is better than filler. Is safer. You use Viso 2, 19 gauge, 38 millimeter thread, short thread. You should be insert this area, like as the columellar stud graft and tip lifting. This is first step. Second step, same entry point, Viso 1, 21 gauge, 60 millimeter, leading the dorsum into the radix, and your area is, your layer is superficial fat area on the nasalis muscle, and you can sagittal cross cut section for Aqualift thread Viso 1. This is epidermis, dermis, subcutaneous, nasalis muscle. Your thread is here. Your thread is here on the nasalis muscle. Okay. In this case, you can make this thread and this. Today or tomorrow, I will show you this technique. Okay. I will show you this technique. Also, look, you can make only one entry point, very, very safer, no downtime, not more edema, not complication.
Just one thread for this way and just one
Yeah.
for this way.
Four threads.
Four thread is columella, four thread is dorsum.
Those.
Four.
No problem. If want to doing combination with filler.
Filler, no problem. For example,
I think for
Only here.
that don't need filler.
for example, this patient, good, this patient, and this patient, look this patient, have minimal hump, okay, and nasolabial angle is short, columella is hanging columella, this area, you know, okay, make the thread, hump 80%, you can hide the hump, okay, not 100%, 80%, and this area is good, columella angles enlarged, but nose tip, this area you can put some filler, is good choice.
After thread.
Yeah, after thread, this area you maybe make it some filler. Yeah, projection the tip.
It's safety.
Safety. On the nose, middle line is safety. Okay, for filler, middle line is safety. Not touch the laterally. This is supra tip. Is safety, no problem. For filler, middle line is safety. But
We can use the thread lateral.
lateral is problem.
Thread,
No,
not feral.
lateral you cannot make thread.
Cannot make.
Thread. Lateral, maybe you can inject a filler, but big problem is lateral.
Just press for the.
Yeah, press the pressure. And this problem is not only occlusion. This problem is press the artery.
Press the artery. This
Press the artery. And 2019 IMCAS Congress, everybody say rhinoplasty, after rhinoplasty, for filler, it's contraindication.
No.
Our plans ideas. In Turkey, we make, no problem. But all Europe,
After NT,
if patient have the rhinoplasty, filler is contraindication.
Why?
Danger. Europe is saying this. Danger. Upright. In Turkey, oh, no problem. Maybe you country, no problem. But all the Europe, no. If rhinoplasty, no filler.
threads no.
Yes. Have any question?
If some complication has in the tip, in the column, after filler and threads, what you can do?
After filler complication, first is hyaluronidase.
Okay.
Second, hyperbaric oxygen. Oxygen.
Yeah.
No more.
Yeah.
First is most of the hyaluronidase. After 1-2 days, one time, every time is minimum 4 hours, hyperbaric oxygen, systemic oxygen. Okay. For filler complication. Hyperbaric oxygen. Hyperbaric.